Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about 6 early signs and symptoms of diabetes. So, if you like the video related to my health, I would like to request you all please to subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. The early symptoms of untreated diabetes are related to elevated blood sugar level and loss of glucose in the urine. High amounts of glucose in the urine can cause increased urine output, frequent urination, and lead to dehydration. The dehydration also causes increased thirst and water consumption. A relative or absolute insulin deficiency eventually leads to weight loss. The weight loss of diabetes occurs despite an increase in appetite. Some untreated diabetes patients also complain of fatigue, nausea, and vomiting can also occur in patients with untreated diabetes. Frequent infections such as infection of the bladder, skin, and vaginal areas are more likely to occur in people with untreated or poorly controlled diabetes. Fluctuation in blood glucose level can lead to blurred vision. Extremely elevated glucose level can lead to lethargy and coma. Now, how do I know if I have diabetes? Many people are unaware that they have diabetes, especially in its early stages when symptoms may not be present. There is no definite way to know if you have diabetes without undergoing blood tests to determine your blood glucose level. See section on diagnosis of diabetes. See your doctor if you have symptoms of diabetes or if you are concerned about your diabetes risk. Now, what causes diabetes? Insufficient production of insulin, either absolutely or relative to the body need. Production of defective insulin, which is uncommon, or the inability of cells to use insulin properly and efficiently leads to hyperglycemia and diabetes. This latter condition affects mostly the cell of muscle and fat tissues and result in a condition known as insulin resistance. This is a primary problem in type 2 diabetes. The absolute lack of insulin, usually secondary to a destructive process affecting the insulin producing beta cells in the pancreas, is the main disorder in type 1 diabetes. In type 2 diabetes, there also is a steady decline of beta cell that adds to the process of elevated blood sugar. Essentially, if someone is resistant to insulin, the body can, to some degree, increase production of insulin and overcome the level of resistance. After time, if production decreases and insulin cannot be released as vigorously, hyperglycemia develops. Now, what is glucose? Glucose is a simple sugar found in food. Glucose is an essential nutrient that provides energy for the proper functioning of the body cell. Carbohydrates are broken down in the small intestine and the glucose in digested food is then absorbed by the intestinal cell into the bloodstream and is carried by the bloodstream to all the cells in the body where it is utilized. However, glucose cannot enter the cell alone and needs insulin to aid in its transport into the cell. Without insulin, the cell becomes starved of glucose energy despite the presence of abundant glucose in the bloodstream. In certain types of diabetes, the cell inability to utilize glucose gives rise to the ironic situation of starvation in the midst of plenty. The abundant, unutilized glucose is wastefully excreted in the urine. Now, what is insulin? Insulin is a hormone that is produced by specialized cell, beta cell of the pancreas. The pancreas is a deep-seated organ in the abdomen located behind the stomach. In addition to helping glucose enter the cell, insulin is also important in tightly regulating the level of glucose in the blood. After a meal, the blood glucose level rises. in response to the increased glucose level. The pancreas normally releases more insulin into the bloodstream to help glucose enter the cell and lower blood glucose level after a meal. When the body glucose levels are lowered, the insulin release from the pancreas is turned down. It's important to know that even in the fasting state, there is a low, steady release of insulin, then fluctuate a bit and help to maintain a steady blood sugar level during fasting. In normal, individuals such as regulatory system help to keep blood glucose level in a tightly controlled range. As outlined above, in patients with diabetes, the insulin is either absent, relatively insufficient for the body need, or not used properly by the body. All of these factors cause elevated level of blood. That's all about the diabetes in this video. I hope you all liked it. Before signing off, I would like to request you all, please do like, share, subscribe this video with your loved ones so that they will get to know better. And more importantly, I prepared a small presentation for all of you that will be going to share in the description box below. Please do look that. It will definitely help you out. So this is Carrie Anderson signing off. We will definitely meet in the next video with my other content. Till then, God bless you. Bye bye and take care.